The Abia State Government says it is taking proactive measures to prevent the outbreak of cholera in the state. Dr. Kalu, Executive Secretary, Abia State Primary Health Care Development Agency, disclosed this in an interview with newsmen on Wednesday. Kalu said that part of measures was the agency's insistence on the promotion of public hygiene and environmental sanitation across the state. And according to him, the agency is also working with the relevant stakeholders to strengthen the campaign on the prevention of cholera outbreak in the state. And he said that cholera as a fecal-oral disease could be spread through the contamination of water or food with feces of an infected person. The official also said that cholera could be considered a waterborne disease because contaminated water remained a common vector or factor for its transmission. Kalu urged residents of the state to only drink water from safe sources and cautioned food vendors against selling contaminated food to members of the public. All right, looking at our measures now, Abia State is not the only state talking about measures that they are trying to put in place to prevent the spread of cholera or the outbreak of cholera in their states if it's not already noticed there, because cholera has been found in different states and it's actually spreading. You know, when it comes to hygiene in Nigeria, our hygiene is very poor. So when we talk about a disease that spreads through poor hygiene, it has the tendency to spread faster than some other places. But like I said, the preventive measures that are put on ground are basic measures. Wash your hands before you eat.
Yes,
don't drink contaminated water. These are things that are basic. So why does it seem like we then have to, you know, put a lot and then start running helter-skelter, putting things on ground and in place to make sure that this kind of diseases do not spread? Do you get my point now?
Yes, actually, I got you. You know, well, first of all, we need to also commend state government that are talking about it. You know, when it comes to the issue of cholera, like rightly stated, is a waterborne disease. It can spread quickly. Now, government need to do more. You know, government need to do more. You know, even our hospitals. The other day I was in BMH. You know, you see a lot of people enter the hospital. There should be this need of you to wear nose masks. You understand? Proper washing of your hands. And when it comes to food vendors, you know, a lot of people patronize this. You know, Nigerians patronize food vendors, and you cannot ascertain where these food are being prepared. So the agency in charge of all this need to go a kind of a task force to ensure that the environment, now sanitation in Nigeria now is now based on you know, is now a state thing. Some states can decide not to do sanitation, other states can just decide a particular day. But the government, the federal government itself, there should be a policy when it comes to environmental or sanitation, that on a particular day, every state should have a day mapped out for environmental sanitation. I know here in River State, the government will always talk about Thursdays, every Thursdays, and that is just for those that are in the market. All of those that live around the vicinity, the residents of River State. So what are they doing when it comes to cleaning up their environment? So our government needs to do more. They need to do, maybe in schools, there should be orientations. You need to go around, even churches, talk to them in churches. What are the measures they are putting in place? If not now that the Abia State government is talking about it, other states, what measures are they putting? The federal government, have you come out to, you know, let the masses know that yes, cholera is actually is now on, and people need to start taking up measures individually, collectively, even as a community. So I commend the Abia State government for the proactive measures, while I also urge other states to borrow a leaf from what Governor Otti, you know, is doing in Abia State. Of course, you know, when it comes to Abia State, the state is more, when it comes to population, it's highly populated, and it's a business area. So I thank the government for that measure, and we pray that even individually as citizens too, we also need to, find a way to ensure that we maintain a very good hygiene and then keep our environment.
All right. Like what I said earlier when you actually started talking, these measures that are being mentioned, that will be put in place, are measures that should ordinarily be in place.
Yes.
Are we talking about orientation? We have agencies for this. Are we talking about making sure that there's food safety, making sure that the environment where some of these foods are prepared publicly are, well, there are people in charge of all of this. There are measures that are already put on ground to make sure that all of these things are working. So why does it seem like it's when we have something like this that is already killing people, that's when it looks like everybody was, okay, everybody wash your hands, let's do this now, let's do that, let's take these measures, and then we'll come out and say, oh, we are taking proactive measures to make sure that this doesn't get to us state. We have with us in the studio Dandy Loveday. He just joined us, and I would really love to get his thoughts on this. But Dandy, how are you doing this morning?
I'm good. Good morning.
Good
Thank
morning.
you for having me.
Welcome
to
ATM Out. Yes, let's hear your thoughts on this story.
When you said
outbreak in Abia State.
They are being proactive in fight against cholera. And then when you go through it, you find out that being proactive, you said they are carrying out orientation, they are trying to sensitize the people, and then they are going to the villages to use the tank rice. That's the proactiveness of a government. I think in doing that, that's good. In sensitizing the people is good, but I think they need to also go beyond that level.
Okay.
What's the proactiveness in trying to sensitize the people? If you sensitize them and then, unfortunately, if the incident happened, how do you tackle it? I was thinking the Abia State governor will go ahead to tell us we've built, should I say, refurnished our health sector. We've arranged it. These are the equipments we've gotten for it. These are our preparedness and all that. All we got there was just being proactive means sensitizing the people. So the government have to do more. They need to do more. They need to do more. I think so.
All right, that's the Abia State government now.
Yes,
what about, you remember, cholera is not just...
yeah, I think it's almost everywhere, both the states.
Exactly,
states,
and we've had a lot of number of deaths. Mortality has been recorded already. So more, like you said, needs to be done. But what do we expect from the federal government at this time? A
lot, even the state government, even. The local government is also involved in this. What's even this cholera issue for those persons that are into health sector? You take, I think it comes more from taking bad water.
Yes, bad, contaminated water, contaminated food, even through handshakes, someone who probably didn't wash his hands and all of those things.
That has if you talk about bad water, do we even have clean drinking water in this country? Why do we even talk about the state? What are we doing in that angle? What of the Ministry of Water Resources? What have they been doing? In fact, we're only basing on what World Bank can give to us. And then at this level, we are still talking about cholera outbreak. It means that the government is not doing something they are supposed to do, to an extent. Why are we still struggling with drinking water at this level? So if the proactiveness should go beyond, let it go beyond orientation. Tell us we have provided very clean water, potable water for these people to drink. Then we have also gone ahead to build health centers. Go and provide
the measures. It's funny that, I was thinking about this story yesterday, and I realized that it's very funny, like I said earlier, that the measures that we are supposed to put on ground as reactive measures are ordinarily things that should have been on ground. We have worked on our health center. Is that not what we're supposed to do on a normal day?
Ordinarily. It also understands that
yes.
we are human beings.
Yes.
Okay.
Yes, we are human beings, and being human too, you need, on a regular basis to be reminded of what you ought to do. I don't actually say anything wrong. Government's coming to say, okay, continue in this process. I know you've been doing this, but continue.
We've not been doing it.
But the question is,
have we really been doing it?
Yeah, that's the thing.
That's what I'm saying.
So
even we as Nigerians, aside the leaders now,
of your hands before you eat. In fact, some person will just wash one part.
Very true.
And then you continue.
We're saying wash hand. They don't wash. Some people just rinse their hands.
That's the right way.
Or they don't wet their hands.
No, the question again is, has that been causing cholera?
Has that not...
What
did... Now, just back to what you said now.
Okay.
Do we need to wait for your neighbor to get the disease or contact the disease before you now say, oh, I'm supposed to wash my hands with soap and water?
Right. We've been washing our hands with soap and water. See, another key thing we must understand is that this thing is not very effective without mere washing of hand. Maybe taking food and all that. It's very effective in taking bad water.
There are measures that we should take, right? We are being told, yes, preventive measures. Wash your hands.
I agree.
This is something we're taught in primary school, right? Or was it just me?
No, we were taught. Right. I also agree.
So I'm not faulting those who have probably have been affected by the disease. No, I'm saying that sometimes we forget the things that we're supposed to do, and then we don't do it.
That's at the individual level.
Yes,
also
I'm talking about the individuals and the leaders.
Yes.
Because it's these individuals that become leaders tomorrow or today, whichever day it happens. But it's these people in the society that then become leaders. So we take that character of not doing what we know is right and we are supposed to do. We take it into leadership. And then we, at the leadership level, do not now do what we are supposed to do at that level.
It also means that the government need to provide the social amenities required. If I don't have soap in my house, how do I wash my hand with soap? Then if the only water available is rainwater with me, what do you expect me to do? Okay, like the last time we had blackout, so many persons were depending on rainwater. In that case, how do you solve the issue?
But as it is in the nation now, everyone now provides his own water.
And they are telling you that that water is not clean.
So
because at the drainage level, we didn't get to the drainage level. And people are still suffering in that level. So the government also need to come in.
So the society at large, we need to be proactive, better than being reactive, right?
Yeah, very well.
For governors to come out now and say, oh, we are sensitizing the people, oh, we're putting this in place or putting that in place. When you look at the things they are stating they are putting in place, are things that should ordinarily have been in place.
Exactly.
So we all have roles to play. I have a role to play. You have a role to play. The next time you see someone who's wanting to eat in public and he's not washing his hands with soap, then you have to speak up. You have to tell him to do the right thing. All right, we all need to do the right thing at different stages of our lives.